Hello, it's Dr. Rhonda Johnson, and today is Monday, June 21st, 2021. And today I'm going to be talking about faith and the COVID vaccine. I do a lot of community education, and in these sessions, I generally get one person who asks a question about faith and prayer and COVID and the COVID vaccines. So there are some Christians who believe that getting the COVID vaccine is demonstrating a lack of faith in God. Many of these individuals continue to hold church services and attend church services during the pandemic. Some don't believe in mask wearing, and some believe that seeking medical attention in general shows a lack of faith. So I always just start by putting it out there that I'm not a minister. I'm a physician. I'm not a person of the clergy. I don't have any special religious training or education. I am a Christian by choice, and I practice my faith in an active way. So I generally try to be practical and just have a conversation that starts off like this. You know, if your car is damaged, do you take it to a mechanic? Or do you wait for God to perform a miracle and heal your car? Or if the pipes burst in your house, do you wait for God to plug the leak, or do you call a plumber? More and more often, I try to get the person asking that question to recognize how faith, medicine, medical care, and vaccines can all work together during this pandemic as a way out of the pandemic. Now, as part of my Christian faith, I deeply believe that God can and does perform miracles of healing, but that doesn't mean we should always expect a miracle instead of seeking the help of physicians or healthcare professionals or medicines or treatments or vaccines. You know, healthcare professionals possess the knowledge and skills to help us, and people have developed science knowledge, research, and skills to develop very powerful and curative treatments for many diseases, and develop prevention screening techniques for many diseases, and develop tools such as vaccines, which can help prevent many infectious diseases. I often will say, you know, Jesus himself in Matthew 9-12 acknowledged the role of the physician in saying, "It is not the healthy who need a doctor, but the sick." And I do know that, like myself, many of my fellow physicians, nurses, and healthcare professionals believe in God and practice their various faiths according to their religious tradition. Sometimes they pray for patients. Sometimes they pray for prior to performing surgical or invasive procedures. Many healthcare professionals prayed to God to lead us out of this pandemic, just like the faithful parishioners. We prayed for the research, the healthcare providers on the front line. We prayed for their wisdom, their expertise, and their strength during some of the hardest times of this pandemic. And some of us prayed for cures for COVID and for a vaccine to be developed for COVID. So again, I don't think the two have to be exclusive at all. And I think they can work together. Now again, this is my personal beliefs. I read something on the internet which went something like this. A doctor can only give you what you'll receive. A surgeon can only operate if you let them operate. A physician can only help those that are willing to be helped. Same is true for the COVID vaccines. True, it is true they are 80 to 95% effective, but only if they get into the arm via vaccination. They can't prevent COVID disease by sitting on the shelf. I do believe that God created us as intelligent beings and gave us the ability to create and to utilize medicines, as well as to learn how to better take care of our bodies. At the same time, those of us that practice our faith and exercise our religious belief should have trust in God, as none of the COVID vaccines are 100% effective. So I try to conclude these discussions by saying that people who ask these questions should continue to seek God for wisdom. And then in closing, I remind them that the Bible is full of references to good health, both physical and mental. Jeremiah 30, chapter 30, verse 7 says, I will give you back your health and heal your wounds. Psalms 14:3 says, the Lord sustained them on their sickbed and restored them from their bed of illness. Proverbs 17:22 says, a joyful heart is good medicine, but a crushed spirit dries up the bones. And then Proverbs 12:25 says, anxiety in a man's heart weighs him down, but a good word makes him glad. So again, the Bible has more scriptures on health and healing. And those of you who continue to pray, please continue to pray that this pandemic will end and that treatments will be developed. And, whatever you pray for, we probably still need to continue to pray because the pandemic is not over. Only 30% of people in the ages of 18 to 40 have been vaccinated. And it's not just the Christian evangelicals or some Christians that don't believe in the vaccine. There are pockets of other religions such as Catholics, Nation of Islam, Hebrew Israelites, and other religious faiths that some members refuse the vaccine. So again, I hope people will choose facts and faith over fear and misinformation, no matter what religion they profess and believe in. This is Dr. Rhonda Johnson. This has been a personal opinion. Again, I'm not a member of the clergy of any faith. I am a Christian and I am a physician. As always, these views are my own. Stay safe and have a blessed day.